This is a case of a lady that had an ORIF of her proximal tibia, and she did have some screws that were protruding out through the medial cortex of the proximal tibia. They were impinging on the MCL and probably the pes tendons as well, and she had constant pain in that region. We went ahead and did an ultrasound guided injection of just the tips of these screws, and it provided significant relief for her.
Here's an interesting case of hardware from a lateral plate on the tibia that is actually poking out through the cortex. You can see here at the inferior aspect of the MCL, and this caused some irritation of the soft tissue in that region. Here we are returning laterally. You can see this plate again that's on the proximal lateral tibia. And here we're making the tibia somewhat translucent, and we can actually see the screws within the bone. And here again is one of these screws that I believe is going out through the MCL and also irritating around the pes tendons. Here we are, we're bringing the pes tendons into view and some of the muscles posteriorly and laterally around the leg. And you can see how the pes tendons are in very close proximity to this screw tip. And this is where the patient was focally tender on exam, and this was again the focus of our injection, was essentially just on top of this screw tip, just as a temporizing measure to give her some pain relief. She eventually did get the hardware removed. Here we are turning medially. Again, we can see these pes tendons, and now we're bringing the lower extremity into the position of the procedure. Here's a bird's eye view of what was done. Essentially, we're going from a proximal to distal approach with our needle, and the needle is in a long axis view relative to the probe. And here we are again, we're just focusing on the tip of this screw where we're injecting our cortisone, which you can see here. The ligaments are somewhat translucent, which again now we're making solid in texture. And here we are zooming out to get another view of what was done. Here's our physical exam. The left knee is the one that's affected. You can see how it has significant laxity with valgus stress, and here's the right side, which has some laxity with valgus stress, but not nearly as much as the left side. Here's an anterior sagittal oblique ultrasound of the proximal medial tibia. We can see the screw protruding through the cortex, causing this darkened signal around it, which may be granulation/scar tissue. And here we're following one of the pes tendons, I believe. It appears as a somewhat dark circle, secondary anisotropy, and I'm only really seeing one of the tendons. There are obviously three of them, but I cannot clearly make out the other two here. And if you just move the probe a little bit, then you'll just have the MCL in view as well as the screw tip. And again, you can appreciate some darkened, irregular type tissue just above the screw tip, which again I believe is scar/granulation tissue. You can see the needle in the upper right corner of the screen, and it's coming from a proximal to distal direction towards the screw tip. And here it's not so clear where the screw tip is. It is just essentially a little bright dot, and it actually becomes more clear as you inject the fluid around it, as you can see here. This is our patient, 48-year-old female. 2 years ago she had an ORIF of her tibial plateau. Does have some protruding screws into the pes bursa. We're going to inject it for the second time. We did this probably like 4 to 6 months ago. We injected and really took away her pain just about completely. And here again, essentially the same as the first procedure. You can see the screw tip pretty clearly in this procedure, and it gets more clear as you inject that fluid around it, basically contrasting the black fluid with the bright metal of the screw tip. And here you can see how close the needle is to the screw, and we're actually able to advance the needle a little bit proximally as the injectate itself forms a fluid plane that makes it less painful to advance the needle proximally.